started analyzing, for example, data from our remote engagement sessions, and you see a close correlation between reps who were much more tenured in that territory were more successful in also motivating their physicians to try out and experiment this new way. So that gives you a lot of insight. One, it's not about whether you are native or immigrant to the digital. Because of the advent of technology, like this session, we are all connected with 12,000 people around the world, and it just comes intuitive to them beyond that initial bump.
On the board of two companies that are unfortunately launching right at the start of the pandemic. New companies, new products, so not an established portfolio. And it is a little bit harder, I think, to establish net new relationships for a new company, for a new product. And I think we are actually seeing in the data that's coming out that physicians are a bit cautious about, particularly without seeing patients in person and without seeing the reps in person, to actually write a new prescription for a new product without being able to see in person what is happening. So that's one piece I would watch for.
What I always encourage any company of any size to do is engage the payer, as we were talking about before, as early as you can in the process. I'd say the best model that we have within a company today is one that actually brings us a pipeline of products that is anywhere between phase 2 all the way to phase 3, and then does routine commercial updates for us each quarter. As was mentioned before by Robin, patient advocacy is a big deal. And if you can get patient advocacy engaged, that also works within the payers. You know, we get letters from individual patients. Our CEOs get called from patient advocacy groups. All of that plays in. You know, again, it's not meant to stifle innovation. We want the right drug for the right patient at the right time.
And it also goes to, I think, sort of capabilities and relationships. The world has really changed. Some of these customers that, you know, certainly that Kent is representing at United Health Group and Optum are so complex, so large, so strategic that it's not about the way it used to be, where you had an account manager that maybe had a relationship, you know, that could call somebody up and try to work out a deal for contracting. You really have to think about what are the capabilities that you need to interact within this consolidated, integrated healthcare system.
I think there's a lot of upscaling too, and upskilling, you know, so we're looking at things like social listening now, which we never did before. I mean, we've got MSLs going to meetings and looking at real-time conversations about the different presentations, and then tweeting to some of the healthcare providers and having conversations right there and then. Or do you want to meet up right after to talk about that hot scientific topic?
The way you hold attention in a virtual engagement is by having really interesting, engaging content that's going to meet the need of that customer. And I think it's more, if we focus on that and less on sort of, you know, the tech or the different platforms, and really think about those virtual engagement strategies and how we're delivering content to a customer's need. I think that is just at the heart of what keeps anyone's attention.